Hello, everyone. My name is Matthew Webb, and I'm a student physical therapist with a CSCS and a BS in nutrition science. Today, I'm going to be talking about folate or vitamin B9. This is going to be the fifth in a series of educational videos intended for healthcare professionals to help us in direct access healthcare fields become more adept at identifying nutritional deficiencies so that we can get patients presenting with one of these diseases the help that they need. So, without any further ado, allow me to present to you folate or vitamin B9. So, firstly, we're going to go into the very basics behind deficiency of folate. Then, we'll break down the science behind why patients are presenting the way that they do. Then, I'll give you some takeaways to help you identify this disease. When a patient has folate deficiency, you may find notable vital signs and neuroscience. And we're going to go further into the science behind these presentations and the risk factors later in this presentation. But I just wanted to provide you an idea of what we're going to be getting into in this lecture right here. All right, here's a DNA slide. So, step one in blue is shown as part of the folate cycle in the bottom left of this slide. Or singled out in bigger format, it can be seen in the top left of this slide. That is step one is where dump is turned into detemp. Step two, seen in the bottom middle of the slide, detemp turns into detip. Then step three, as can be seen in the bottom middle or in larger format in the bottom right, the tip goes on to be used in DNA synthesis. So let's ask ourselves, what part of the body requires the most DNA and RNA synthesis? Because that's what's going to be impacted by this. You think about that question? All right, let's check it out. It's blood. The adult body creates around 200 billion red blood cells per day through erythropoiesis using erythropoietic stem cells. Even though mature red blood cells don't have DNA anymore because they eject their nucleus before entering circulation, it still requires a lot of DNA synthesis to manufacture so many of these guys. Due to the decreased DNA synthesis and folate deficiency, something called intramedullary hemolysis can become more common than not, which is red blood cell death in the bone marrow. Red blood cells that do manage to live to maturity become large and unshapely, and often they don't successfully eject their nucleus. These big guys are significantly less efficient at carrying oxygen. It's kind of like a fat water boy in sports. Those fat water boys don't have a good success ratio when it comes to getting you the resources you need before the next play. People with folate deficiency are full of these fat water boys, failing to get them the resources they need when they need them. All right, this slide is just dedicated to DNA methylation, which is a vital process in deciding which genes are going to remain active or inactive. So, without folate, the methionine cycle can't produce our body's key methylator, SAM. Without enough methyl donation to effectively inhibit certain genes based on cellular signaling, we can run into issues. A methyl donor deficiency is associated with increased risk of cancer and some other not so nice things. All right, hopefully you haven't got forgotten over the past few seconds, but in case you did, there's this guy called Sam, and he's the most important guy in her body for donating methyl groups. But he's got a team to help him, and they're baton passing this methyl group, trying to get it to dependable Sam. But in this case of folate deficiency, one of Sam's teammates, 5-methyl THF, is not holding his weight, and he lets Sam down. So Sam doesn't get to bring that methyl group to where it needs to go, and as it turns out, this is not good for our nervous system. Sam's donation is required for phosphatidylcholine production, and phosphatidylcholine is actually important in the sphingomyelin synthesis process. If you remember from the paradoxine or vitamin B6 video, sphingomyelin is important for myelin production. Note, these molecules are more important in the peripheral nerve myelin, and longer, larger peripheral nerves, such as A beta fibers, are impacted by myelin degeneration first. All right, you've seen this slide 2 times already, once in the riboflavin video and once in the paradoxine video. Let's review though. When homocysteine levels rise from something like an impaired folate cycle, then it can become homocysteine thiolactone and bind to collagen. A little fun fact is that this mechanism that causes homocysteine to become homocysteine thiolactone is essentially a protective mechanism, but it's still going to cause problems in our collagen synthesis nonetheless, as it reacts with the lysine residues. Homocysteine can also downregulate the gene needed to transcribe the mRNA for LOX production, necessary for proper collagen cross-linking. These aspects will inhibit collagen from becoming its stable, mature, insoluble form. Instead, collagen fibrils become relatively structurally disorganized and fragile and remain water soluble. Here are some risk factors you can look out for. Alcoholism impairs folate absorption due to intestinal damage. Folate is used up in alcohol metabolism. Alcohol acts as a diuretic, increasing urine production, thus increasing folate excretion. Celiac disease is another risk factor because it causes intestinal damage and decreases absorption. This disease also requires a gluten free diet, but wheat products are fortified with folate, meaning a major source is unavailable to these individuals. As far as drugs go, sulfadiazine, which is a DMARD, can impair folate function through multiple mechanisms, which include acting as an inhibitor for a protein that carries folate into the cells. Diuretics cause increased excretion of the water soluble folate. Methotrexate, a chemotherapy drug, inhibits one of the enzymes in the folate cycle, which can functionally cause folate deficiency. Subjective questions to ask would be about past medical history, and you should make note of celiac disease and ask them what medications are they taking. Make note of sulfadiazine, diuretics, or methotrexate. Ask about any alcohol consumption, and of course, find out what that looks like. Folate deficiency is very common in people with severe alcohol use disorder. Diseases that individuals can be at greater risk for with folate deficiency are anemia, atherosclerosis, and neural tube defects. For clinical exam in the integumentary system, findings would be lip ulcers, oral findings would be swollen and red tongue or glossitis. Vitals may show tachycardia, which is a common compensation for megaloblastic anemia. Respiratory rate can show tachypnea, which is another common compensation for megaloblastic anemia. Note, the patient may be more easily fatigable than their history would indicate they should be. That's a really patient specific statement, but it's something to consider. Neurofindings include peripheral neuropathy with sensory signs appearing before motor signs. An example of a finding that folate deficiency could cause would be impaired proprioception and position sense of ankles bilaterally. The main takeaways as far as the what, why, and how behind the presentation is that the lip and mouth integumentary and oral findings are to be expected as well as vital and neuro signs. The mouth sores and glossitis is due to the collagen inhibition from elevated homocysteine levels. Feel free to read the why on that if you need to, but if you've watched my other videos, you've already heard me say it a million times. The vital signs of tachycardia and tachypnea are compensations for megablastic anemia, which is due to the impaired DNA synthesis from folate deficiency. The neurosigns are due to 5-methyl THF from the folate cycle not passing the methyl baton, so it can get to Sam, the methyl donor that wants to donate the methyl group to some myelin structural molecules. This, of course, will mean myelin is going to break down. Note, due to the higher levels of phosphatidylcholine and sphingomyelin in the peripheral nervous system, that means the peripheral nervous system is going to be impacted to a greater degree than the central nervous system. And here are my resources. Thanks for watching. Note that I'm making these presentations during a pretty busy semester, so I'm liable to have made some mistakes. If so, let me know in the comments, and if your correction checks out, then I'll either add it to the video description or I'll pin your comment. If you learned something from this video and you want to learn more, continue on to Cabal.